Good evening to all of you. Today we are going to discuss the case note of Mr. Alvin George. The case is a surgical removal of benign tumor from his left calf. So the letter is to a community health nurse, and her name is Miss Leon. She's working in Oxford Community Health Center, Oxford. So we are writing this letter to the community nurse to make a home visit for Mr. George further care after discharge. So we have a lot of care after discharge. So we need to inform those to the community health nurse in order to make arrangements for the same. So let us go ahead and see the case in detail. The patient's name is Alvine George, and he is 69 years old. Was admitted for the surgery on 6 June 2019, and 14 days he was in the hospital. Today, that's on 20 June 2019, he is being discharged. The diagnosis is removal of benign tumor in left calf muscle. So when we are writing to the community health nurse, social history becomes important. Mr. George's son lives abroad, a retired bookkeeper, divorced, pensioner, ex-wife lives nearby and helping, non-smoker and a social drinker. So this is what the social history is. So even though he has no one to care at his home, he is getting assistance from his ex-wife. He's financially stable because he has his pension. This is what we have to see in the social history. The his medical history is not that much relevant. We don't have any relevant medical history, but we have found that he is hypertensive and diabetic before the operation. So we have started the medicines, lisinopril and metformin 500 mg. We have had a review of occupational therapy and physiotherapy, and we have advised him to visit the diabetic clinic every month. Now, after the surgery, his vitals were stable, but he had fever, chills, and his wound was infected, for which he was started antibiotic, that's amoxicillin 1 gram TDS for a week. Now wound is healing, no pus, no fever, walking with frame. So the course of the antibiotic is over. So he is good now. He is walking with frame. Now during the hospital stay, the nursing care which were provided, that were showering, daily wound dressing, and the nurses reminded of taking medications regularly. Now, the discharge plan is that we have to write a letter to the community nurse for care and medication complaints, dressing changes, encourage independence with activities of daily living, and if he needs other help, the nurse has to assist him. Review at diabetic clinic every month, monitoring of blood pressure and blood glucose, and continue physiotherapy and dietary advice. So this is what we have the writing task, no, the discharge plan. Now we have discussed the writing task. Let's go ahead with the sample. So Miss Leon, Oxford Community Health Nurse of Oxford Community Health Center, Oxford. Mr. Alvine George, age 69. Writing to request a home visit for Mr. Alvin George in order to make necessary plans for his future care. So this is a particular home visit which we are requesting to Miss Leon. And the purpose of this home visit is to make necessary plans for his future care. He has a lot of problems here, so we'll be discussing it later here. He's recovering after a surgical removal of benign tumor from his left calf muscle and is being discharged today. So this is what we have the purpose here. And when we go ahead, we can see the present history. Mr. George was admitted for the aforementioned procedure, that is a surgical removal, on 6th of this month, that's the 6th of June 2019. He successfully completed his course of antibiotics despite having fever, chills, wound infection, and post-operatively. So, so he had a fever, chills, and wound infection post-operatively. So we can better write it like he had fever, chills, and wound infection post-operatively, and antibiotics were prescribed, which he successfully completed. So we can make a rearrangement there. So let us change the sentence structure upside down. Instead of completing the course of antibiotics initially, we can write it later, so that would look better. He was also commenced on lisinopril 5 mg daily and metformin 500 mg twice daily for his high blood pressure and blood sugar levels. So this is what the medications which we have commenced. Okay, he had physiotherapy and occupational therapy reviews along with daily wound dressing. So it's not that much important. So it's an optional sentence. His wound is healing at present and he can walk with the help of frames. So that's important there. Now, regarding the social history, Mr. George is a retired bookkeeper and lives and receives monthly pensions. So he has his sons. So his sons live abroad. However, he gets some assistance from his ex-wife who lives nearby. So relevant social history is mentioned here about his financial status, who are there to help him. So that's written. So the requirement paragraph, if we go where we can see, it would be appreciated if you could make arrangements for monitoring Mr. George medication complaints, blood pressure, and blood glucose level. So three things here comes first. He also needs assistance in wound dressing, getting dietary advice, continuity of physiotherapy, and any other personal help. So the second sentence deals with another set of assistance. Now, the third sentence here, please encourage him to perform his daily chores, that is activities of daily living, independently and arrange monthly review at the diabetic clinic. So this is what the paragraph is organized, all the requirements, that's the discharge plan is mentioned there. That's a simple letter. If you have any further queries regarding Mr. George's condition, please do not hesitate to contact me. Yours sincerely. No, so the only thing I have here to review is the second sentence here in this paragraph. So we need to change this thing. So the antibiotics will come later, the problems will come earlier. So that is the end of the explanation. Thank you, and we'll be meeting with another letter soon. Till then, bye.